want all of you to network and meet each other and learn from each other and see how together we can achieve this shared vision of prescribing healthy homes.
I've never taken care of more children who've died from asthma than before going to Newark, New Jersey. And guess what? Every kid that died from asthma was a poor black child. And their parents worked, and they did the best that they could. We gave them the best medicines. Some of these kids are maxed out on inhaled steroids because they go home and they're living in basement apartments with mold, everywhere. Their zip code is killing them.
And in addition to the personal toll and the family toll that it takes, as people have mentioned, we're spending $65 billion every year for the asthma-related costs, including hospital stays. Now, with that price tag, wouldn't you think it would be sort of obvious that when we've got an inexpensive and easy way, relatively easy compared to other solutions, of using at-home asthma interventions to reduce this, that we could do a better job. And EPA is committed to joining with all of you in trying to do that.
Most Americans with asthma do not currently have access to these evidence-based services, which incidentally, as Desiree reminded us, are also recommended as part of the clinical guidelines for best practices in asthma care.
There's a lot of folks out there that have got environmental problems, but they don't have the wherewithal to do anything about it, okay? And I look at it, spending tons of money on all kinds of expensive meds, but it's going down the toilet when the trigger is all the molds in the house and whatever. It's kind of like you're getting nowhere. You're treading water, basically, at best.
What we're really trying to do today is connect the dots, is to think about how the city, state, federal agencies, the community-based organizations, the health systems can more effectively work together, share information, and get families the interventions that they need to prevent and reduce environmental exposures.
With this study, we hope that we are going to provide the basis for a world in which doctors can be sitting down with their parents of children who have persistent asthma and ask them the question, are you dealing with pests in your home? Are you dealing with cockroaches? Are you dealing with mice? And as we all know, in the same neighborhoods that have high prevalence and severity of asthma, they have high poverty and they have lots of pests. So the answer is going to be yes. And then the doctor today asking that question is going to be like, well, sorry about that. But what are they supposed to do? And our idea is that at that point, that doctor could write literally a prescription for safe and effective pest control. And then we at the health department could act as a referral to a pest control company that is capable of providing an integrated pest management intervention that is, again, safe and effective for an individual unit, and that would then be paid for by the insurance provider.
Look, we have all this information on triggers. How can we incorporate it? How can we actually utilize it in the field to ensure that we're reaching significant health outcomes for our asthma patients?
And hopefully, by addressing both our home and our environment, will help not only those who have insurance and are able to be insured, but maybe those who can't be insured by making our entire community and our homes healthy.
I'm very optimistic, or I wouldn't still be doing this after so many years, but every day if there's, not 9 people, but only 8 people, hopefully there's no people who die because of asthma.